Good afternoon and welcome to the 8th briefing from Protect Our Province BC on Thursday, January the 6th, 2022. A quick reminder that Protect Our Province is a grassroots group of physicians, nurses, health scientists, health policy specialists, and community advocates all working together to end the pandemic. We begin our briefing by recognizing that we're broadcasting from the ancestral, unceded, and stolen lands of the close to 200 Indigenous nations in this place we now call British Columbia. We acknowledge that the stewardship and kinship of the First Peoples of these lands since time immemorial is the kind of leadership and the way of being that we seek. And I think as we make a transition from the land acknowledgement to talking about schools, we should probably take a small moment of reflection to remember that school is not always an idyllic place where everyone gets everything they need and are well supported. And hearing the word school can conjure up a range of emotions for folks. At this time, we've started this briefing today with also a bit of a sense of urgency, which is calling it a SOS school briefing. We really do want schools to be open, make no mistake about that, but we also want to know how we make it safe. So today at our briefing, I'm Dr. Brenda Hardie. I'm a family doctor in Vancouver, and I'll be facilitating a discussion between three folks today. Our steering committee members, Jen Heighton, who's the co-founder of Protect Our Province BC, a teacher and also co-founder of Safe Schools Coalition, Jaclyn Ferreira, who's a researcher and a disability and inclusion advocate, and as well today we have an expert advisor, Dr. Colin Furness, who's an assistant professor of knowledge management and information management, Faculty of Information Institute of Health Policy Management and Evaluation, Dalla Lana School of Public Health, University of Toronto. So excited today to have Dr. Furness with us, and we're going to start with him. If we could have Dr. Furness on the screen with us, that would be great. Fantastic. Welcome. So Dr. Furness, we've got a few questions for you that we want to talk a little bit about to help to straighten out in our minds a little bit about what's going on with schools. It's same in BC as it is in Ontario. Parents are a bit confused and concerned about whether or not their children should be in school. And so we want to, hear from the expert a few things that can maybe help us to figure it out, what is the best way to proceed here. So I think a great place to start is to ask you, is Omicron mild?
That is a vital question, and it's actually an incredibly complicated question packed into so few words. The first part of the answer is it depends whether you frame COVID as a respiratory virus. If you frame it as a respiratory virus, you have permission to call it mild, to say that it's nothing but sniffles for kids. And that's commonly out there, and I've heard that articulated in BC and elsewhere. But here's the thing, COVID, before we even get to Omicron, COVID is not a respiratory disease. It's a vascular disease that has an initial respiratory phase. In kids, and increasingly in adults, the respiratory phase is less dangerous, less acute. It looks like sniffles. The problem is not the sniffles. The problem is what the virus is doing elsewhere in the body, from the toes to the testes to the brain. And it is causing autoimmune disease. It is causing loss of brain tissue. We haven't seen that in children because we haven't looked, but we've seen it in adults, literally brain tissue disappearing. And autopsies of bodies have shown residual virus present 6 months after infection, 6 months. So this virus only begins in the lungs. And if we're going to talk about is lungs, and I really, really dislike that framing, then we can call it mild, but I'm unprepared to do that. And I find that infectious disease doctors are not speaking up about this. This is their wheelhouse. I don't want to pretend to be an infectious disease physician. I don't want to pretend to be a pediatrician, but I'm not hearing this description from them. I'm hearing some epidemiological pronouncements from them, which I disagree with. But in terms of trying to characterize this disease, we've got to call it what it is. Let me compare it to another mild disease. This other mild disease has a reproduction number of 6 or so, about the same as Delta. So it's about as contagious as Delta. And in most kids, it's either asymptomatic or it's the sniffles for a few days, and then it goes away, and then it clears up. Let's call that a mild disease. The problem with calling it a mild disease is I'm describing polio. And that means that rarely, less than 1%, vanishingly small proportion of kids have serious neurological outcomes, including severe paralysis in some cases. It's very rare, but I've never ever heard anyone call polio mild. If we referred to polio as a respiratory virus and invented something called long polio that we put in a different room for different people to talk about, we could call it mild. So I think it's very much got to frame this virus for what it is, not for what we can see, not for what we would wish it to be. So long COVID, which is what happens after the respiratory phase, it's still poorly defined. It's difficult to study. The prevalence is anywhere from 5 to 40%, depending on how you use criteria in terms of the symptoms and the length of persistence of symptoms. It's very prevalent in children, and it is, well, as I say, very, very prevalent in children, and even if the children have a mild case, a mild acute respiratory case. So it's not a question of if they didn't look very sick, they didn't get very sick. That's not it. It causes autoimmune disease that we call MISC, the inflammatory syndrome in children. And again, what I believe would be brain tissue loss if we actually bothered to look. Now, let me just say that Omicron is making the conversation even more complicated. Why? Omicron appears to be, ironically, starting to behave like a respiratory virus. And for adults, it seems to be that its ability to do the dreadful work, to do the systemic body work, to target the immune system and to target the brain, that seems to be impaired in Omicron. And that's really good news, sort of. Because as it becomes a respiratory or starts to behave more like a respiratory disease, it's starting to hit children harder. And that's what I'm really concerned about. We have very little data about Omicron. And I don't want to listen to anyone talk about severity of COVID in kids using old data. We've got to talk about Omicron data. It's absolutely pointless to look at what kids used to experience before Omicron. Omicron is what we need to be worried about, and it's different. It's absolutely different. We can show that first slide that I have, which is US hospitalizations. We have done lousy data tracking in Canada. I didn't want to use UK data because they count things differently. They count admissions differently. They're mixing together admitted because of COVID versus with COVID. But the US has excellent reporting. And this is typically the picture that makes people go, see, I told you so. It's not very serious. But as an epidemiologist, I look at this graph and it honestly makes my blood run cold. It's that orange-yellow line at the very bottom that looks so flat while all other age groups are rising and falling. That line just looks so flat, except at the very right. If you see in that very bottom right corner, just above the words Jan 2022, it starts to inflect up. Now look at that. It's way higher than at any point previously in the pandemic, even though the overall population prevalence isn't nearly what it was, let's say back in January 2021. So we've seen all of a sudden child hospitalizations jump by a huge degree. The only reason, there's a mirage here. The only reason it looks low is because the y-axis is scaled for very large numbers. If we simply took that off and produced this graph, which by the way, I can't easily find out there, if we produced it just for this age group, we could use a scale that would make your blood run cold too. Hospitalization, child hospitalization is way up with Omicron. Yes, more mild for adults. Yes, more mild perhaps with respect to long COVID, autoimmune disease, brain damage, but it's putting way more kids in the hospital. And we only have vanishingly recent data for this. And so it's easy to dismiss saying, well, that could just be a bump. The problem is it really isn't a bump. It's the beginning of what looks like a pretty big incline. So that's a long way to look at, or a long answer to a short question. I'm not quite done yet. If we could show the next slide, let's sort of dig into what does that little bend in that orange-yellow line really mean? Okay, so based on previous waves, we thought about 1 in 200 children with COVID were hospitalized. That's the estimates vary in different places, but they kind of converge around there. And I accept that overall hospitalizations from Omicron are actually a lot lower. Again, mild for adults. So let's assume for a moment that it's milder for everyone. Instead of 1 in 200 kids to be hospitalized, we might expect 1 in 400 to be hospitalized, right? That's what we might expect if kids were behaving the same way as adults with Omicron. But if we look at just the last week of December in the US, they had 325,000 cases in under 18 age group. That's across the entire US. So that's a big number, but it's in a big population. They had 4,700 hospital admissions per week. So that's what that looked like. That's 1 in 70 being hospitalized. Now, I want to be clear, that's probably a big overestimate, right? And the reason for that is the denominator. We're probably under detecting COVID in kids for the reasons that we always have. We pay less attention, the cases aren't as severe, and of course now in the US as elsewhere, we're just unable to test. We're unable to detect all the cases. So there's a different way to compare these. In other words, I want to be able to take this data from the US, and instead of just giving you an inflated number and saying be afraid, let's look and see what this would be like if we map the US numbers to BC's population. So if you can go to the next slide, please. So if we said there were 4,700 admissions per week in the US, for the denominator, instead of trying to guess cases, let's just use the overall population. It's crude, it's unadjusted, it's a very back of the envelope way to do this, but it's actually quite clear. That is to say that for a population of 330 million people, that produced 4,700. So we know the population of BC is much smaller. It's about 5.5 million. So if we adjust that, we would see that that turns out to reflect just about 78. If Omicron behaves the same in BC as it does in the US, we would expect about 78 admissions per week. But here's the problem. If you want to go to the next slide. The problem is that yellow-orange line is tilting upward. It's not a straight line, it's tilting upward. In other words, the rate of increase itself is increasing. So hospitalizations in that last week in December in the US increased by 65% over the prior week. So let's assume for a moment that orange line turns into a straight line, turns into a diagonal straight line and doesn't arc up any further. We could expect week 1, week 2, week 3, week 4, we could expect this giant total of nearly 800 admissions, child admissions in BC. Now that's not necessarily critically ill, but in fact, not necessarily at all, but that is a very large number. This rate of increase may continue, it may pick up speed, it may level off. The fact of the matter is, truly, we don't know, right? This is a very simplified projection, assuming that what we see in the last week in December in the US it applies to BC and continues in the same direction. So it's a very simple representation, but it is alarming because that is 800 child admissions to hospital within 1 month in BC. I think would be really quite a strain. So that's my way of saying, is it mild? Well, if we had 800 mild admissions, we might say, okay, we're just going to have to put up with it. Maybe we'll have some stretchers on the floor for a while. But we have to get back to that question now. What's Omicron doing to kids? Let's look at the next slide, please. So risk factors for serious COVID. Okay, so 78 weekly hospitalizations may be manageable if they're mild, but if they aren't, let's look at some of the risk factors for serious COVID. Being less than 3 months old, that frightens me because the odds ratio is 7.8. That means you're 7.8 times, almost 8 times as likely to develop serious COVID requiring hospitalization if you're under 3 months of age. Now, we can't stop people from being under 3 months of age, and we can't isolate them from their parents and their siblings and the community. We can't saran wrap them. We just can't. And so they are enormously at risk. Diabetes, very prevalent in kids. Far more than it ought to be. That increases your odds of serious COVID by 6.6 times. Premature birth, which has immune system implications, 3.7 times. A compromised immune system, which some kids have, it's a lot less prevalent, 3.5 times. And asthma, which is fairly prevalent in kids, more than doubles the chance. Now, of these, being very young, being under 3 months, and having asthma, those are significant predictors for requiring ventilation. And so when kids need to be ventilated, they're seriously ill. My understanding is that British Columbia has 27 acute care beds that it shares with the Yukon. That's not very many acute care beds if we have a bunch of kids under 3 months old and a bunch of kids with asthma becoming ill. So that's my answer to your question. Is it mild? Mild for some, mild for adults, milder than it was in those cases. Yet child hospitalization is going up, and I'm worried. And I got to say it, I'm not looking at Omicron as a mild ride for kids.
Okay, thank you for that detailed answer. It helps us to kind of get a little better picture. I think quite a few folks have also been trying to get across this message that even if it is milder, a smaller percentage of a very large number can equal a very large number that will overwhelm our healthcare system. And if those happen to be pediatric patients in particular, BC is very vulnerable to overwhelm given our very small number of pediatric ICU beds and also our geography. So many people living in remote and rural communities, infants being transported to our highly specialized center in Vancouver. This is just not a prospect that anybody really wants to have to think about, but this may be in fact what is coming. A small shift, but still just sticking with a little bit of the basics of COVID and Omicron. Why do you believe there is some debate about whether or not COVID is airborne? Why, about the airborne transmission?
I have a shorter answer, and this is a white-knuckled answer. We need to stop talking about whether it's airborne. In July 2020, 239 scientists wrote a letter to the World Health Organization, and they said, here's evidence that cannot be explained by droplet. That's all they said. It can't be explained by droplet. We need to consider airborne. And there was a huge backlash. There was an enormous backlash that said, no, respiratory viruses are droplet. They've always been droplet. All of our evidence says it's droplet. We could have a long talk about scientific evidence and evidence quality and how the evidence is understood. I want to leave that for a different time. But I guess what I'd like to say is that this to me represents what some have called the Sasquatch problem. You only need one Sasquatch to prove Sasquatch. So when you have transmission events that can't be explained by droplet, you need to look for another explanation. And that's something that a lot of people hadn't wanted to listen to. It was my colleague and former teacher, David Fisman, who made a very powerful point not long after. He said, well, the reproduction number seems low. It looks like it's in line with respiratory diseases, but it's an average. Most people back in those early days of COVID didn't give it to anybody. But once in a while, someone will give it to dozens of people. And that doesn't happen with respiratory spread. It really doesn't. Or you could say, well, if it's a wedding, maybe one person hugged absolutely everyone, and that's how it happened. But then you've got restaurants and buses and places where people aren't actually hugging or moving around and interacting, and you still had transmission. Not a lot of it, but again, how many Sasquatches do you need to be able to say Sasquatch is real? And so the phenomenon, I've got to say it, the phenomenon of super spreader events, which we've known about since that Washington choir way early days of COVID, that tells us it's airborne. It just does, because we don't see super spreader events for things that only go short range with droplets. I've looked at data for Toronto Transit Commission bus drivers. And what's interesting about this is there was a belief that bus drivers might be at significant risk because they seem to be getting sick a lot. And so I compared the data from them with infection data from subway drivers and streetcar drivers. Demographically, they're three similar groups. So it's a nice natural experiment. Well, bus drivers are the only ones that share air with passengers, and they're surrounded by plexiglass just with little gaps on the side. You couldn't sneeze on a TDC bus driver if you tried, but you're still sharing air. Their rate of infection was a lot higher. Again, smoking gun evidence. That didn't stop the Ontario government from going to court to argue against airborne spread. And I know that airborne has been resisted at government and public health level across the country at various times, particularly persistently in BC. We've got to stop talking about this. If there's any doubt, the Omicron variant has now been estimated at its reproduction number to be about 18. That would make it right alongside the upper limit of what we think measles is. So it's either as contagious as measles or more so. The thing about measles is someone with measles can leave the room, and 2 hours later, people walk in the room and get infected. Everybody gets infected. You can't tell me that is droplet. And by the way, measles is an RNA envelope virus. It presents like a ball with spikes. It's morphologically very similar to COVID. It's up in the air. It stays there. Omicron is spreading with the same alacrity as measles. It can't be droplet. It just can't. And I think the final piece of it is more and more people are going to have absolutely no idea how they got infected. It used to be almost 2/3 of people had no idea. Unless it was a family member, they really didn't know. Now it's going to be almost impossible to find out where people got it from. So it's airborne. Of course it's airborne. And to deny that it's airborne is simply to put people in harm's way. We have to stop talking about that. We can say aerosol, we can say little droplets, whatever floats your boat, but we need to understand it's in the air, and we have to stop talking about it.
Yes. And I think that these things that you've just presented to us all kind of come together for our conversation today, essentially about Omicron and schools. And you in particular felt so strong about this, knowing that it's in the air, that it lingers in the air, and knowing that the discussion about it being mild, was really not very beneficial for planning for getting kids back to school, and the actions that were taken or not taken, were really quite significant. And that here we are at the beginning of the new year, nothing has really changed, and we're supposed to be sending our children to school. So it prompted you to write a letter to, I believe it was the Toronto Medical Officer of Health. Is that correct? Yeah.
Yes,
Can you tell
that's
me
right.
what prompted you to do that?
I listened to the briefing from Ontario's Chief Medical Officer of Health, who announced that everyone was going back to school right on time, and that there was going to be no disease measurement at all, but we were confident somehow that schools were safe. And that didn't add up to me. And I've been looking at the Omicron data. I've been looking at really early indications of hospitalization data. I didn't even have the data that I showed in the slides. That wasn't even available yet. But we saw some early indications, and I thought to myself, this is a perfect storm. We're in denial about Airborne. We're not going to issue teachers with N95 masks. In fact, teachers are in Ontario were being disciplined if they tried to wear an N95. And so that really worried me. I'd also, unlike BC, Ontario was actually doing some effort to measure infections and outbreaks in schools, and to be diligent with that, and to not try and come up with criteria to exclude cases from this. I looked at a line listing, and this was a few weeks ago. I looked at a line listing of outbreaks and infections in schools in Ontario. A line listing is simply every new infection gets a line, and it's got a date and it's got a place. And so you can kind of see this thing unfolding in time. I saw adults coming into school with COVID. I saw them giving it to each other, teachers. I saw the teachers then giving it to kids. I then saw kids giving it to kids. Now, there's some instances where it's a coincidence, but where there's smoke, there's fire. There's no question there was transmission going on. How could there not be with an airborne pathogen and inappropriate masking, inadequate ventilation, inadequate air filtration, classrooms without windows, the same sorts of problems that I'm sure some BC schools have as well. And so I looked at this and I thought, this is not okay. We can't open schools. We can't. We need to do three things. We need teachers to have N95 masks. And in Ontario, that means 1 million of them a week. We don't have those. We need rapid tests. Well, we burned through our supply because we didn't bother buying enough because we resisted using them for so long. And we did a half-hearted HEPA installation, and that probably prevented a lot of infections. But not every classroom has one, and not every room in a school has one, and not every school even has forced air ventilation. So we've got really unsafe schools. And I wrote that letter to say, look, I want schools open. I'm a parent. I've got kids in the system. I saw the harm. I absolutely see the mental health harm to kids, to their families. The learning outcomes are lousy for so many. Some kids do really well online, but many do not. I want schools open, but I want them open safely. That was what my letter was about. And I guess we could actually just look quickly at that last slide.
The slide, yeah.
Yeah, so I looked at, in my letter, I analyzed the data in Ontario to say, how many unvaccinated kids do we have? I'm only interested in looking at unvaccinated kids because vaccinated kids are very unlikely to go to hospital. And that's as far as we can see. But unvaccinated kids do. So looking at BC, these numbers are actually really big. No one under 5 is vaccinated. So you've got almost 250,000. You've got then 63% of kids, that's high, who are not vaccinated. So you've got almost 500,000 kids, of which a large proportion are attending daycare or school. So there's a lot of kids here. They're the ones who are going to get COVID. They're going to get it all at once when schools open all at once. That was my fear in Ontario. That's my fear for BC. Why? Because Omicron is as transmissible as measles, and because no one is wearing adequate masks, and because there isn't adequate air filtration. There's only one way this is going to unfold, and that is mass infection of kids through their teachers, with their teachers, and it won't keep schools open anyway. You can't open a school when all the teachers are down sick, even if they're not in hospital. So when I looked at this in Ontario, I thought, I've got to do something. I've got to write that letter.
Yes, thank you. Yeah, that is very sobering. 217,000 children at risk in daycare or school with no vaccine, either not allowed or don't have it. And as you say, this situation is similar here in BC. And I'd like to bring on both Jen Heighton and Jaclyn Ferreira just to talk a little bit more about the situation in BC right now. And maybe we'll start with you, Jen. Why do you think there's this ongoing debate about transmission in schools?
Well, there's a lot of debate about transmission in schools because, number one, on the ground, the reports from parents and teachers are vastly different than what's being represented by public health. So number one, testing is being discouraged in families. If you don't have symptoms, you're told not to get tested, where we know that a good at least 45% of cases are asymptomatic. And so those cases are being completely missed. The other thing is that there were lots of reports from the ground of positive cases that were not reported to the health authority websites. In fact, there are more cases that are not reported to the health authority website than actually made it onto the website. So there's an example. For an example, one school in Interior Health had at least 3 cases in every single class. It spread to siblings in their classes. Some of them spread to their families. There was only one exposure letter that made it to the health authority website, even though this was happening over several weeks. And the teacher at the school where this was happening, at one point she was like, there's so much spread going on, I'm sure we're going to get a functional closure. But there never was. There was never a functional closure. So it just kept going through the school. And it was extremely stressful. In terms of mental health, this part is not being addressed. The fact that when there is widespread illness spreading through a community, there's a lot of stress on the students, the staff, the families involved. And when kids are going to class knowing that the right protections are not in place, then you're worried about your physical health. So you need to take care of your physical health as well as your mental health. And we all recognize that in-person schooling is ideal, and we much prefer being able to have that interaction. However, if it is so important, the mental health of children and to be in school, then invest the money it takes to keep them safe while they're there.
Mm-hmm. Yeah, I think you make a good point about the mental health, because we keep hearing that the only thing that children need for their mental health is to be in school. And while I know that there is, a good amount of truth in that, if they're in a school that is unsafe for them, and kids are smart, they probably know that COVID is airborne and that it's hanging in the air. And if not, if you tell them, they'll figure it out really quickly. So it can't be great for your mental health to be put in a situation where you are at risk. And even if you're fine, you're worried about your family, your friends, the people you're bringing it home to, your grandparents. So it is tricky to balance all these things, but I think we can't be a single message that the only mental health thing that's important for children is in school. Jaclyn, I'm just wondering about what's your experience with respect to, from a parent perspective, regarding the debate around transmission in school.
Well, to speak first to the mental health side of things, when you say that is true, our kids know that they're at risk because they know we have a genetic disorder that puts us at risk. And so when they announced the return to school way back in spring 2020, our daughter at that time was in grade 4, she was 9, and she was like, but they've been saying all along, masks and fewer faces, bigger spaces, what's going on? So they know. And her mental health was worse knowing that they were willing to put her in a school that didn't have the proper safety procedures in place. So it is really it's infantilizing. I know that they're kids, but they're smart, and we have to presume competence, not incompetence. And a lot of what we do presumes incompetence. As for spread in our school in the first month alone had 8 exposures. It spread between classes. It spread from kids to vax to adults. And the only reason that we know that the spread happened, that there were exposures, was because parents were letting other parents know. So it was on the background feed or whatever. None of the exposure notices ever were posted publicly. So yeah, like if we were sending our children in, and we are not, like we have chosen to call them in sick every day because we have no other way of protecting them and also keeping them tied to their school, which is something I can talk about later. But yeah, like we had originally planned on sending them back part-time in October. But once it started spreading kind of like wildfire in the school, we were sort of faced with having to make that decision. Like, it's actually not safe to send our kids to school right now because they're not doing the things that we know would keep them safe. And we're blind to it because they're not releasing that information.
Right. So, Jaclyn, what are the things that would make schools safe for your kids and probably for all kids?
All kids, yeah. So, I mean, it's pretty basic stuff. Monitoring the air quality for starters, improving the ventilation, but meaningfully. Just saying that you've installed MERV 13 filters, but actually not monitoring whether or not they're working doesn't really do a whole lot. And a lot of the ventilation systems in our schools are old. They're not capable of using MERV 13 filters, or if they are, they're maybe not doing them effectively. All we have for our school and all of the schools within our district is a report that states that they're swapping out the MERV 13 filters every holiday. That's all we know. We have no idea what the air quality is. There are parents in our district that are sneaking air quality monitors into the classrooms to measure the CO2, and they're finding that actually the air is not clean. Because of this, our teachers are not aware of what tools they need to use, like open the windows, go outside for a few minutes, eat lunch outside, like all of these things that would lower the CO2, thereby lowering the rebreathed air in the classrooms. We need better masks. Right now, masking is hit and miss. It's not mandatory. And the recommendation is the best mask that you can find. But we know that a cloth mask is not effective in comparison to an N95. And I know there's the debate about whether or not it's fit tested, but there's been enough study done now of those masks that they're good. They filter out the air, and kids are capable of donning and doffing properly. We've taught even our 4.5-year-old to do it. Lower density, so fewer people breathing in a space. I have a whole list, sorry.
That's okay.
Also testing, like we have no idea, like we're not testing why, like kids have always been limited in their access to testing in BC, and especially now because the system is so overwhelmed. We've never used rapid tests effectively in schools. So we have really no idea of where it's spreading or how quickly it's spreading. And then we're not using the tools to keep the air clean and keep the kids safe inside the buildings. And then there are other things like, music class, gym class, places where they just let kids take off masks. But if you're breathing into a wind instrument, what do you say? Like, what are you breathing out into the room, right? So all of those sorts of things. And, I need to also add equitable remote options, because there are children who still, it will not be safe for them to be at school, especially when community transmission is high. And in BC, the government decided not to fund remote options this year, like in other provinces. So families were faced with removing their children from their community school and risking not being able to get back into their community schools again afterwards, because a lot of our schools are also over-enrolled. So it's all of these things playing together. COVID has just magnified how bad our system is, basically.
And that's a terrible place to be, adding that extra layer of distress on top. If you could just have a safe, equitable alternative during this time, even that, in and of itself would bring some relief. So thanks so much, Jaclyn, and for that perspective. I'm just looking at the time, and we want to make sure there's lots of time for folks to ask questions. So I'm thinking what we could do is just quickly shift to a bit of a summary of some of the things that we've talked about and the things that Protect Our Province BC is essentially asking. And then we will open it up to questions. Does that sound okay for everyone? Yeah. Okay, so Carrie, if I could get our summary slides, that might be helpful. Great. So in summary, we're talking about the things that need to be done right now to make schools safe, and because we want schools to be open. We think that at this time, we really need some strong public health orders to reduce contact. We as has been given all the information right now, the tremendous amount of transmission, knowing that it's lingering in the air, as long as we're keeping so many things open like malls and arenas and schools, these are places where lots of people come together, and restaurants, and they take their masks off and they breathe their air into the room, and then it's there, for other folks to inhale. So this kind of thing just can't be happening, especially with the rate of transmission being as high as it is, and especially without the understanding in our province, without the education, without any supports to help schools, businesses, hospitals to have the appropriate safety mechanisms in place. So we do think this is a critically important step. We also think, as Jaclyn has said, that remote learning needs to happen right now until the transmission is reduced. We need to make our community safe so that we can make schools safe. In order to do this, we're definitely going to need better supports. We can't just close things down and expect people to take the hit and figure out how to survive. We critically need supports for businesses, for wage relief, for parents. We know that there are some federal resources that are available, and understand that it is not possible for folks in BC to access it because schools are still open. So one of the ways that we'll be able to access some of those federal funds is if we do have strong public health measures that will help to allow people to access those sorts of supports. And we also believe that our provincial government could be putting in much stronger supports to help people to do the thing that they're asking them to do. But in this case, we're actually asking for structure to make it happen, which is what public health is supposed to do, and provide the supports that are needed to allow people to do it without excessive suffering. And while we're doing this, it's an opportunity to upgrade protections across the board. So in particular schools, during this time, it is time to be used wisely, which is to create schools that are safe. So what it takes to clean the air, we've talked about that, I won't go over it again, but knowing that it is critical to have appropriate ventilation, filtration, masks, and monitoring, not just putting things in statically. It's quite critical to monitor to make sure that the protections you're putting in place are working. And also vaccination. I think just seeing the abysmal rates of vaccination that we have, especially in the younger age of children in BC, we need to change our program. Our program is so slow, and we're not really getting these kids quickly. And if we want schools to open, we need to be able to vaccinate them more quickly. We've got a lot of work to undo, which was the message to them that COVID doesn't transmit in schools and children are safe. And so it's difficult for parents then to think that they should vaccinate their children given the messaging. So we've got to have some strong public health and education messaging so that folks know it's quite important to vaccinate your children now. I think those are the majority. There's certainly more, and I would actually direct you all to our website, on Protect Our Province BC website. On our landing page, we've got a good summary of all of the things that we are recommending that should be done across the province, that you can do individually, that institutions and larger groups can do, and as well things that we think our government and public health should be doing to assist us all to move towards protecting our schools. All right, so everyone's ready to take a few questions, are you? Great. Okay, so here's the first question. Are classrooms not a major source of transmission, as Dr. Bonnie Henry recently claimed? This is Nicholas Pescod, Czech News. Who would like to tackle that one?
I can start, and then I think my colleagues may be able to add to that. Look, kids under old COVID were only spreading to each other about half the rate at which adults were. So when original COVID was not very contagious, a basic reproduction number of 3 or 4, for kids that was a lot lower. And so we didn't see the kind of transmission that we would have expected. And in hindsight, we may have done too much school closing when we didn't need to, out of an abundance of caution and without vaccination. But right now, we are seeing it. We are seeing transmission everywhere. It's fully in the air. It's like measles. You just got to understand it's like measles. And if you're going to ask me, do measles get transmitted in schools? Oh yeah, they do. They get transmitted on airplanes too that have excellent ventilation and filtration. So, if you don't believe it, wait a couple weeks and open schools. And that would be a horrible way to find out. There's no doubt in my mind that transmission is going to be happening in schools. We saw it in Ontario. I saw it in the data, and it increased dramatically in that last week before we closed. No question in my mind.
Mm-hmm. Yeah.
I would like to say that another point to make about transmission is that right now the transmission in the community is higher than it's ever been. It is off the charts, and our positivity rates across the province, test positivity rates, are off the charts as well. We have areas in the Greater Vancouver area that are between 20 to 50% test positivity. And there are some areas in the interior and north that are 60%. And so if you're opening classes when there is such a high transmission in the community, then you are upping the chances that there's going to be transmission within the school as well, that they're going to bring it in the school and that they will pass it around. I mean, let's face it, they are in a congregate setting where the room is highly occupied with 20 to 30 students and a few staff, and that room is not that large. They cannot sit 2 meters apart. They're more like 1 meter apart if you're lucky. And they are breathing each other's air for a long time of the day, unless you have decent ventilation. And not every classroom has that. And so this is why the province needs to take it much more seriously. They are a source of transmission. It has happened in BC. It's just it was never recorded.
Yes, thank you. And I would direct people to our second briefing where we did show the data of transmission in schools in BC, if anyone wants to look at that, or could also listen to Dr. Teresa Tam, who indicated that her major concern leading up to the holidays was the transmission that's seen in schools across the country. So certainly lots of evidence to suggest that it is, in fact, a major source of transmission. All right, next question. Should K-12 students be returning to classrooms in BC right now? Nicholas Pescott, Check News.
Well, I think I answered part of that with the previous part in just that it is such high transmission right now. And the other thing I should say that can add to that is we've had a collapse of testing. And so there is no way to know why some people are away. They might be away and they're feeling sick, but they don't know, is it a flu? Is it a cold, or is it COVID? And because right now the testing is so limited, they are prioritizing it to healthcare workers and people over age 65, then the majority of the population, the school age population, is not going to be able to get a COVID test. And that includes their parents. And so that means if somebody is sick in your household, you are not going to know what it is. And so how are we going to know whether or not to send children back to school, or staff members? If you are feeling under the weather, you're not going to know whether you can't get a PCR test. And the rapid tests really are meant to be a surveillance tool. They're not really meant to be a diagnostic tool. And so in the situation where you can't even tell you're flying blind, I do not think that K-12 students should be returning, especially when the K-5 kids are 40% of kids have only 1 dose of vaccine. They're not even double dosed yet. That's single dose only.
Yes, thank you. I'm going to throw a little extra question in there. Maybe Dr. Furness, you'd like to answer this one. So if not now, when?
I think that's a great question. We can't measure cases anymore because we don't have the ability to do that kind of measurement. The only thing we have is, given a steady testing regime, given that you don't change anything at all in how you're doing your testing, to watch positivity. If testing stays the same, positivity will tell you if cases are rising or falling. We have to wait until after it peaks. That would be probably 2 or 3 weeks, maybe 4, but probably 2 or 3. We won't know till we know. You never know you're at the peak until you've actually passed the peak. Mm-hmm. Once you've hit the peak, the case rates will come down very, very quickly. This is going to be a very short wave. That's how it works. It's Farr's law. The sharper the incline, the sharper the decrease. It's going to be symmetrical. So I don't see months of this. I see weeks of this. 3 is halfway between 2 and 4, so I'll throw a dart at that number right now. Don't hold me to it because we really need to see about that peak. But that's what it feels like to me.
Great, thank you. Okay, we'll go back to our regularly scheduled questions. What data around schools and transmission should BC be reporting publicly in your view? Moira Whiten, I hope that's how it's said, the Thai.
So maybe I will just talk to what the reporting system looks like, and then Professor Furness, you could explain what Ontario reporting system looks like. So in BC, number one, we have a very nebulous definition of what an outbreak is. Oftentimes there are several cases within a class, but they do not call it an outbreak. For example, there was one in Surrey last year where there were 50 cases connected to 5 PE classes, and that was not called an outbreak, just because of it's under the discretion of the public health officer. So that's one thing about data around schools here. The other thing is that there are lots of times where exposure letters will go out, but there'll be other cases going on in the classroom, and they do not get an exposure letter. So, you know, they've now started to put some of those on the website, but the number of ones that show up on the website do not match the number of positive cases that are in a classroom. And like Jaclyn said, the only way people know about it is when parents and staff members actually, you know, find out just through the grapevine how many cases are in a class. So that's the type of data that BC has been presented with.
Thank you.
Let me build on that. The Ontario experience is being to try valiantly to count cases up until the closing for the holidays, and then to throw up our hands and say, everyone's catching it. We can't count this fast. We just can't. We can't test. We can't count. You know, if a kid is missing from school, this was the plan. We're going to open on time, and if a kid is missing, then I guess they've got COVID. And you know, that's not contact tracing. That's not surveillance. That's simply watching the casualties mount, and that's just bears no resemblance to public health. When you've got something that everyone's going to catch, if they put themselves in an exposed position, there is no reporting you can do. There is no surveillance you can do. It stops to have meaning. So it is a pretty grim situation when you've got Omicron that is as transmissible as measles.
Great. Jaclyn, from your perspective, are there any other things that you think are missing from what you would want BC to be reporting?
For us, just knowing where the cases are, you know, like not knowing if they're at our school and not knowing what we're sending our kids into. One really great example, last year they did offer remote options. So we had our kids home, obviously, and there was COVID in my son's classroom, and he would have been a close contact. There's no way he could have avoided it had he been at school that day. And we wouldn't have known because of the contact tracing rules in our schools. So it's 15 minutes plus face-to-face. And if the person is masked. So that means that it completely disregards airborne spread. People are not wearing good masks. Like there's no way around it. So he would have been a close contact. And so for families who have children with rare diseases or disabilities, not having that information means that they're gambling with their kids' lives. And, you know, I shouldn't have to say this, but these kids will go on and live full lives. I have the same rare disease and I'm in my 40s and I think I've lived a full life. I don't think I deserve to be like, you know, sort of cast off as like, well, if you get sick, you'll just be counted as someone who had an underlying condition. I think that's unjust and these kids deserve better. So having that information so that families can make accurate risk assessments is so important, and we can't do that. We just can't.
Yes, thank you. I think that is one of the things with even the discussion about being mild and saying, you know, schools are safe. That kind of information maybe settles okay for folks who believe or know that their children are not at particularly high risk. If you're from an affluent family and no one has any health issues, and if someone got sick at home, you might even have a spare room where you might be able to isolate. But for the majority of people, this is just not their reality. And so it feels like you're just being thrown to the wolves. No one's even understanding or knowing what it's like for you. And I do think that going back to school, this is some of the discomfort that we're hearing from a lot of parents is like, well, what about us? What about our situation? How can this possibly be right? So thank you, Jaclyn, for sharing a bit about yours.
Just as I mentioned, that there are close to 40% of people in Canada, including kids that don't know they have an underlying condition, and they won't know until they're older. So there are parents who are making that decision. Oh, we're affluent, we have an extra bedroom, we have access, we have a family doctor. Like, these are all things that not every family has, but their kid might still have a genetic disorder or other condition that they don't know about, and they won't find out until their child has COVID. Like, we should be preventing it from happening so that they don't face that.
Exactly. And as you've said earlier, Jaclyn, if you make it schools safe for children with vulnerabilities or who have been made vulnerable, then you've made schools safer for everyone.
For everyone, yeah.
Do we have another question? We do. A media advisory for Dr. Henry and Ministers Dix and Whitehead is set for tomorrow. What do you hope to hear from them? Moira White and the Tyee.
So I think that it should say Minister Whiteside. She's our education minister. And it is, okay, so what we would hope to hear from them are definitely the things that we have mentioned already here, which would be immediate remote learning for everyone until community transmission is lower. It would be, in the meantime, while that's happening, you ramp up the vaccines for both children and for the staff members in the school, so that, you know, when we do reopen, more people can stay healthy and not have to close down. I did hear that today that in Toronto, the health authority in Toronto has decided to set up 27 vaccine clinics just for education. And so, because right now in Ontario, they're having a 2-week delay of reopening of schools. And during those 2 weeks, they have 27 clinics to ramp up the vaccines for both the children and third doses to the staff members, because they recognize, looking at the hospitalization rates of children in Toronto, they have realized we need to get these protections in ASAP. And so they have redeployed some of their vaccine deliverers to specifically target the schools. So I think that needs to happen. Plus, during that time, we need to get those airborne protections in. And I'm not going to review what all of those are, because we've mentioned them in the briefing, but all of those airborne protections and rapid test. Get that rapid test program going for schools. Lots of other places are using it. California is using a rapid test, in a lot of their schools for kids to come back. And I think we can do that here too.
Great, thank you. I think there might be one more question. Or not. Oh, here we are. Ingrid Schmoll, how you wear a mask is more important than wearing an N95. Is this accurate advice from Dr. Henry? I'm assuming that's who Dr. H is.
Let me start
Professor
with that
Furness.
one. Yeah, well, coincidentally, I had an article published in the Tyee about 2 hours ago on this topic, and so that's a good place to look for a bit of a discussion. Whatever mask you wear doesn't matter if there's gaps, because it doesn't matter what it's made out of if you're breathing in and out around the gaps in the top and the sides. So fit on one hand matters absolutely huge. However, I think what's not really quite accurately represented in that advice is that a blue rectangular medical mask tends to gap. They're one size fits all, which is to say it fits almost nobody. Some faces actually work really well with that rectangle mask, but all faces are different. And the thing about an N95, they come in slightly different shapes. It would make sense for people to get a few different types and try and figure out which fits best. But an N95 tends to stick to the face. It's designed to do that. It's shaped. And it's got the strong enough elastics, and it's got certified fabric, so it's by far superior. Now you can use what's called a mask brace. You can get an elastic thing that you strap over your head that presses the medical mask to your face. That will help a little bit, but all it's trying to do is to make gaping masks resemble N95 masks. So yes, how you wear it matters, but it's enormously difficult for many people to wear a cloth mask or a rectangular blue mask in a way that doesn't gap. So to me, it doesn't actually change the advice. We've got to move to N95s, at least for that reason.
Great, thank you. Is there another question? Can you explain the specialty required to run pediatric ICU wards, of which BC only has 27 beds? So I can speak to that, or Professor Furness, if you want to do that. No, okay. So pediatric intensivists are very specifically trained, and it is a sub specialty. I think what is probably really important for folks to know is that children in hospital are, as we say in medicine, not just little adults. Their physiology is very specific. And so you can't just take things you do for big people and cut the amount in half and expect that to work for children. It just does not function like that at all. You really do need to understand and know the pediatric situation quite intricately, and if no place more than any other, that would be in pediatric ICU. So if we suddenly need to have a lot of children in pediatric ICUs, even if you have beds, pieces of furniture, places in the hospital to put them, what you're not going to have is people to take care of them. And that's not just the intensivist physicians, but this is the nurses, respiratory technicians, lab technicians. I mean, everybody who works in those sorts of situations is very highly trained to be able to take care of children who are acutely ill. So I think my concern with this is that should we start to see the kinds of numbers that we are worried about seeing in pediatric hospitalizations, and we know that a significant number, just based on percentages of a large number, can end up in the ICU. We really don't have not only the beds, but just the trained folks to be able to adequately take care of children. Of course, someone would be redeployed into that area from another area, but redeployment is always a scary prospect. And I haven't looked at it very carefully today, but I do see the BC Math Modeling Group has released some new, very sobering projections on just hospitalization rates in British Columbia. And if it were to come to pass as they are estimating, we wouldn't have anyone to redeploy to pediatric ICUs because they would be already deployed throughout the hospitals. Yes, go ahead.
I just wanted to add to that I think often the public thinks of the pediatric ICU beds as just there and ready. The BC Children's PICU right now, as of like earlier this week, a parent was reporting that all of the beds that were available, so there was not enough staff for the beds already, and the majority of the pediatric intensive care beds in our province are in that hospital. So already not enough staff, and all of the beds are full. Because in not mitigating COVID, we've also allowed other things like RSV and flu to spread. So all of those beds are full. So if now we're having a wave of children getting COVID at school in the coming weeks, where are they going to go? There's no bed. There's no bed for them, right? Like we're already at this point, and we're not hearing that from the government. We're hearing it from people on the inside who are telling us that. So for the parents who are unaware of that fact, they're also going into this unprepared as well, right? Like it's just the beds are not empty and waiting. The beds are already full, and that's a problem.
That's a huge problem. All right, I believe that was our last question, and we are at 5 o'clock. So I think we will say a thank you for sure to everyone for joining us today. And I think Jen has some follow-up slides just to summarize what are the actions that we are recommending, and in particular an action that she would like to share with you that's very new today. So maybe I'll just have the slides up and we'll turn it over to Jen for that.
All right, so we are excited to announce that 3 major advocacy groups, that is Protect Our Province BC, Safe Schools Coalition BC, and BC School COVID Tracker, are joining forces and collaborating together in this community action to pressure our government to protect our children in schools and in childcare settings. This is a phone, zap, and email campaign, and the next slide is going to explain the details. So if you could bring the next slide up. We are asking all people in BC who are concerned about school and daycare safety to call or email our government leaders tomorrow, Friday, January 7th. This graphic that you see on the screen here will be spread on all of our social media accounts and on all of our websites. The phone numbers and emails, you'll see them on the left side, and those are for Premier Horgan, for Minister Dix, for Minister Whiteside, and for Minister Farnworth. But you can also look up on the government website and email or phone your own MLA in your own constituency. There is a script. So on the white area of the graphic, there is a script there and a list of measures that you can choose from that you wish to see for your school or daycare. Please tell your leaders what you want to see them do for our children and our families. We recognize lately that there have been quite a lot of people distressed about the plan going forward. At Safe Schools Coalition, we've been receiving many emails from parents who are worried about what next week will look like with the high community transmission going on. And so this is your opportunity to let our leaders know what you think. And please take some of the facts from our briefing today to let them know what they can do. Thank you so much.
Great, and that concludes our 8th briefing from Protect Our Province BC. And just to remind you that we do have access to all of this information on our website and more. So please have a look, and we look forward to having you back at our next briefing. Take care, everyone.